Earlier this year, Governor Shapiro signed Act 1, allowing people who are at high risk for breast cancer to get screened at no cost to them.
It would remove a big barrier for many women to stay on top of their health, right? But as CBS 21's Jessica Babb found out, not every woman in the state is covered, not even close.
Starting our day with a poster board and an unscientific poll.
Hi there, how are you guys doing?
Standing in downtown Harrisburg, starting a conversation about breast cancer, a cancer many women have a connection to.
I had some family members that had breast cancer, which thank God, they're in remission, so that was a good thing. But also because my very first mammogram, I had 3 lumps that were found.
You never know. Like, I thought I was healthy, but when I was screamed, like, they found something.
In fact, the American Cancer Society says there's a 1 in 8 chance a woman will develop breast cancer. If you put that in terms of Pennsylvania's population, more than 800,000 women in the state will have breast cancer.
Early detection saves lives.
Treating breast cancer when it's small is much easier.
With the rising cost of healthcare, this bill
requires insurance companies to cover the cost of preventative cancer screenings for women at high risk of breast cancer.
Governor Shapiro taking part in the pomp and circumstance back in May when he signed Act 1 into law.
By taking away the burden of cost, we can ensure that more women like them can get life-saving health care that they need.
Helping women who are high risk for breast and ovarian cancer.
That will provide MRIs, ultrasound, genetic testing, and genetic screening for women at high risk who are covered under Pennsylvania law. And that means no copay, no coinsurance, and no deductible. And we're thrilled about that.
Oh, that's a wonderful idea, because a lot of people think that may be an expense that they cannot afford.
And while this law, championed by breast cancer survivor Senator Kim Ward, will help hundreds of thousands of Pennsylvanians.
When your insurance company told you no previously, when they said, oh, you've got to go find the copay. Oh, well, we would do genetic testing, but we don't cover that. We've got a strong message right here from the General Assembly in Pennsylvania. The no is turning into a yes.
Not everyone will have that no turned into a yes.
You have to check with your insurer to make sure that your particular insurance is covered under Pennsylvania law.
Act 1 only applies to about 25% of Pennsylvanians who have fully insured commercial policies. That means closer to 75% of people won't be covered by this law. If you have any type of federal insurance like Medicaid, Medicare, or TRICARE, Act 1 doesn't apply to you, but you may still get some of the screenings covered depending on your plan. For others, you might think you're covered, but you're not. 27% of Pennsylvanians have employers who are self-insured. That means the employer is paying directly for the cost of healthcare. They're assuming the risk for these costs and are likely using a benefits administrator to process the claims, which makes it hard to tell if you're covered or not. For instance, your plan might have a Blue Cross Blue Shield logo, but it's governed by federal regulations, not the state. It doesn't matter if you live in Pennsylvania or the service is being provided in the state. It might not be covered. You could still be slapped with a big bill for hundreds or thousands of dollars for these screenings.
Insurance is complicated. If they're covered under federal law, Pennsylvania legislators cannot force the feds to do what we did here in Pennsylvania.
Do you think that more needs to be done both statewide or federally to, help those who are high risk for breast cancer and be able to give people access to these screenings?
We've got it covered. We're the first in the nation to cover it for high risk women at no cost. There may be other things that we can do, and we have a pattern of doing things that are needed. On the federal level, that's up to Congress.
They need to do more so it could be accessible to all women.
Thank you for passing that law, and I'm hoping that it can expand to more women in the future.
Depending on your insurance, if you do qualify for free screenings under Act 1, it could take effect in either 2024 or 2025. If you don't have insurance, you may qualify for a program through the Pennsylvania Department of Health.
All right, so Jessica Babb's here with us now. The numbers were interesting. Of course, we gave us a lot of attention when it first came through. and we thought this was going great. What had the idea for you to get into this a little bit more?
Yeah, so personal experience was what really caused us to start digging into this. So a coworker of mine, a coworker of ours, ended up getting one of these breast cancer screenings, MRIs, thinking that she'd be covered. Turns out she got a bill for hundreds of dollars. Even me personally, my mom's had breast cancer this year. I'm high risk. I talked to my doctor. You know, she referenced Act 1 legislation. We tried to get me an MRI screening because I don't qualify for mammograms yet, and it turns out I have federal insurance, so I don't qualify either.
Wow. So if we're calling our insurance company, what specifically do we need to ask to know if we're covered?
So calling your insurance company and also your employer is a great place to ask, but figure out what kind of insurance plan do you have. Is it a commercial self-insured plan? That means your employer is paying for the cost of healthcare, or is it a commercial fully insured plan? A lot of big insurance terms, but your insurance provider and your employer will be able to walk you through step by step of if Act 1 covers for you.
Right, but you said 3/4 are probably not covered at this point.
Yeah, about 75% of Pennsylvanians not covered. And a lot of that really is because only about 25% of Pennsylvania's population has an insurance that the state controls. And essentially what's happening is the state law can't control if it's a federal program or under federal regulations.
Okay, so the parts they can control, they've done something new with, which they like. But
absolutely.
when
It'll still help a lot of people, just
Yes.
not everyone.
Gotcha. Not as many as we hope. Thank you so much.
You.
Yes.